Hello and welcome to Spinal Chat. My name is Dr. Ivan Stoyev and I'm a board-certified neurosurgeon working in Nashville, Tennessee. I perform a variety of procedures on the brain and the spine, but my passion and expertise is spine surgery. I did a spine fellowship after my residency training, which is an additional year of studying the traditional open and minimally invasive techniques for spine procedures. Now, the goal of this channel that I created is to share my expertise and my knowledge with the general public. Now, you may be an experienced clinician or a medical student or a resident or even just a regular person who may be facing the prospect of spine surgery. So I hope that you will find this information valuable. Now, this is going to be a series of lectures that I'm going to do on a weekly basis. This is the very first one, and we're going to talk about back pain and some of the background behind that and why we even suffer from back pain. Back pain, unfortunately, is part of the human condition. We're all going to suffer from it at some point in our lives. And the short answer to why that is gravity. I mean, the other slightly longer answer is because we walk on two legs. We also tend to live longer than we used to. So these additional years of life add on to this burden of wear and tear on our spines. So in order to understand our spine, we need to go back. We need to go way back. Our ancestors gained a significant evolutionary advantage by walking on two legs. That freed our hands to use them to carry tools, to hunt, to have weapons, to create art, to carry provisions so we can travel further, and to even allow us to develop our brains further in our dexterities. It also allows us to look a little bit further so we can see predators and resources, and created an environment for us where our bodies became very energy efficient. So let me explain what I mean by that. We are the only truly obligatory bipedal mammals in the world. Some other animals can walk on two legs, such as birds, of course, and some of the mammals can do that too. Some of the primates can walk on two legs for a short distance. Bears can walk on two legs. Kangaroos can do that as well. But this is not a natural thing for them. I mean, they can only do this for a short distance at a time. And the reason for that is it requires a lot of energy. It's not a very efficient way for them to ambulate or get around. There is a crucial difference between our spines and that of, let's say, the great apes. Now, if you look at a human spine here behind me, you can see that there are three basic curvatures going in opposite directions. We have the cervical lordosis, thoracic kyphosis, and lumbar lordosis. All of them put together make the letter S. The net effect is that our head is sitting directly over our center of gravity, which is in our pelvis. And this is a good thing because it keeps our bodies in a natural state of balance, and that requires the least amount of energy. By having this alignment, it basically allows for the forces of gravity to be transmitted through our skeletons, through our bones, rather than our muscles. Now, in contrast to that, let's say a gorilla, for example, has only one curvature in their spine, and that is in the shape of the letter C. So when they stand upright, their head is actually forward, and that requires more muscle energy and effort to keep them in a balance and to even maintain that state. It is like balancing a stick on the end of your finger. Now, the human spine, because our head here is in straight line with our center of gravity, maintaining our balance is fairly easy. But if you can imagine a weight at the very end and you're holding the stick at the other end at an angle, it requires some effort to keep that stick in that position. And this is what monkeys and other mammals experience. Now, the gorilla center of gravity is in the thorax. So the forces of gravity are distributed among all the four limbs, but that's a lot of muscle groups to really keep the monkey or the ape in stationary position and to even walk. Not a very energy efficient state. Humans are endurance hunters. You know, we developed this strategy of hunting by being able to traverse a long distance, whereas the other animals tend to get exhausted by the time we reach them. We're able to catch up with them and kill them. But that's what our ancestors did. We're able to travel a much further distance than any other animal trying to walk on two legs. And we do so by expending the least amount of energy. Well, this is all very good, and it was very helpful for us to do that, but unfortunately it comes with a price. And that price is back pain. Now, when you look at the human spine again, you will notice that there's an uneven distribution of forces on it. For example, when you look at the very bottom level between L5 and S1, which is the very bottom disc right here, you can understand that this disc is supporting the weight of the entire body from the waist up, including anything that we hold in our arms. And as we move up into the spine, there are less forces. So when we get to the top of the cervical spine, really the only weight is the head and some of the muscles that are pulling down on the spine. Disc degeneration or spine degeneration is a natural occurring process that is progressive, and it occurs throughout our lifetime. There are different reasons for that. For the lumbar spine, for example, it's the load bearing that is causing that degeneration and wear and tear. For the cervical spine, it's not so much the load bearing, it's more the range of motion. It is the most mobile segment in our spine, so there's a lot of demand with motion there, and that leads to this degeneration that occurs. Now, but you may ask, why doesn't the disc regenerate, or why can't we just heal our spines back to a normal state? And the reason for that is that we lose our blood supply to our discs very early in our development. So these degenerative changes start to occur pretty early on, like even in your late 20s and 30s, you can start having some degeneration of the spine. And this process accelerates and progresses throughout life. So naturally, the fact that we live a long life now makes us susceptible to suffering from back pain. And it becomes more prevalent as we get older. So I would say that the majority of visits to the emergency room and the majority of visits to the primary care physician are because of back pain. So this disc degeneration that occurs, that we mentioned before, can have consequences in the long term. But it's not all bad news, because there are some things that we can do to circumvent that or slow down this degenerative process. And one of the things that we can do is to avoid obesity, because the more weight we have to carry, the less demand on the spine and the less wear and tear that occurs. Another thing we can do is to not use nicotine. Nicotine has been clearly linked to degenerative changes in the spine. So there are many studies on that. A third thing that can be helpful is to have a strong core. The strong core basically provides internal support or splinting of the spine. So it shields the spine a little bit of these forces that cause degeneration. And the last thing is to choose your parents carefully, because there's some genetic component to really degeneration of the spine. Now you may ask, why do we have these curvatures in our spine? Why don't we just have a straight spine like this stick, for example, and that will keep everything in balance? And is there any benefit to having these curvatures there? And the answer is yes, there is. The spine acts like a spring. So it shields our brains from the impact of walking and running. And there's also a shock absorbing capability of the discs as well. And the overall effect is it's really designed to protect our brains from getting scrambled and damaged from just everyday activities that we do. So when we talk about back pain, it's important to understand that back pain is not a diagnosis. It's a description. It's a constellation of symptoms. It really carries no significant meaning to a clinician. The back pain oftentimes is multifactorial, and even the majority of times we don't really know what is the cause of a particular person's back pain. Now, we do know some things that can cause back pain, and those are well established, such as a herniated disc that can compress a nerve. An infection can cause pain. Tumors can cause pain. Trauma such as bone fractures and things like that can cause pain. Spinal deformity can cause pain because it puts us out of alignment, and that creates a lot of muscle tension and fatigue and whatnot. So there are some things that we know and understand very well. But the majority of the time, when a patient presents with back pain, we do not know what the origin of that is. And it's okay, because the majority of the time, and as a matter of fact 95% of the time, this pain goes away on its own with some time. We usually say that if the pain persists more than 4 to 6 weeks, then that warrants, further investigation. And that would necessitate some imaging, such as an MRI of the spine, to look at the anatomy. Until that point, we recommend conservative management, and that includes physical therapy for core strengthening exercises, cervical and lumbar traction, non-steroidal anti-inflammatory drugs, TENS units, skin patches, epidural injections, facet rhizotomies, and some of the other procedures that the pain doctors do. Surgery is the very last door we open. It's the very last thing we do because there's no returning from that. So conservative management is the first defense against back pain. I'm going to spend a lot more time in the future episodes describing a little more of the anatomy of the spine, some of the treatment options that we have, some of the pitfalls and drawbacks and mistakes that can occur with spine surgery, and some of the reasons why we have bad outcomes, because not every outcome is as desired. So we're going to shed some more light on this in the future episodes. But for now, I wanted to lay the foundation, explain the reason why I'm doing this, and as always, your comments and questions are welcome. And if you like the content of the channel, please hit the like button below and subscribe to my channel. There will be more episodes to follow. I'm going to try to do this on a weekly basis. So I really want to thank you for tuning in and sharing your time with me. Thank you very much, and I'm looking forward to our next meeting.